more recently, well, I guess for the last decade at least, my team in this country, but multiple research teams and practice teams around the world have been advocating for a diet that is not low in fat, but restricted in carbohydrate. And when you restrict carbohydrate, then the reduction in glycemia and insulinemia are primarily outcomes that can affect good health. And so when we start to do trials around that, we've done a couple of those randomized trials of that type of approach versus conventional approaches, both with healthy people with weight issues, and people with diabetes. And there's a few hundred of such randomized trials done now. Then you see they're more effective than conventional low-fat or energy-restricted treatment. These are not diets where people are asked to restrict their energy. They're just asked to restrict their carbohydrates. They can eat fat and protein to an extent ad lib. So yeah, that's where we're up to at the moment, and we've been doing that for a while. As you mentioned earlier, I've also written several books on that to try and translate some of that. US Further Health has just been running a large clinical trial of low carbohydrate diabetes with health coaches as the contact person, and the results are astonishing. Frankly, the 2-year results, they had I think 53% of people in the intervention group had reversed or put their diabetes into remission. Reversal being no longer diagnosable but still taking some medication. Remission being no longer diagnosable and on no medications for diabetes whatsoever. And that sort of rate is, compared to the conventional treatment where there was hardly anyone that happened to, is frankly astonishing. But as you'd expect with the disease of carbohydrate intolerance, you can either try and use some of these latest drugs like the SGLT2 inhibitors. They help you pee out more glucose, but as a basic idea, how about not eating it in the first place, which is our approach.